Um, Approximately 13 years ago, when I was riding my snowmobile, I stopped for a pee, and to my surprise, I noticed that it was very red. The next morning, I went to the hospital and told the doctor on call my condition. He did not seem too alarmed. I was told to take it easy and get some rest. The blood in my urine actually, it seemed to go away and settle down. Approximately 10 months later, I had a reoccurrence of the blood in the urine and saw a different doctor. He seemed baffled and was unable, and he was able to get me in to see a urologist within a few days. When the urologist performed a cystoscopy, he noticed that I had tumors in my bladder. Having just received the diagnosis, I was devastated, and we attempted to find out more information about bladder cancer on the internet, but there was very little information available that could answer our questions. We arranged a date for the removal of the tumors and set up for BCG treatments. After 2 surgeries and numerous BCG treatments, all seemed to be well. About 5 years passed, then I had a reoccurrence and the tumors came back. My first urologist referred me to Dr. Drakenberg because my situation was becoming too complicated for my first urologist. Dr. Drakenberg suggested that I have my bladder removed and a new needle bladder constructed. 6 years have now passed since my surgery. My health has gotten better and my life is back on track. As a patient, I cannot thank all the people in the medical field for all the help they've given me over the years. Last year, at the Canadian Urological Association, David Gutman from Bladder Cancer Canada here met Dr. Daryl Drakenberg, and he said there was no representation for bladder cancer in Manitoba. Dr. Drakenberg suggested that I would be someone to contact in Manitoba. David contacted me and I accepted. I am honored to represent Manitoba on the board of directors for Canada. Now that my health is better, I feel privileged to give back and help others. It makes me feel good to give support and answers to any questions that bladder cancer patients may have. As a patient, you should never feel ashamed or embarrassed to ask questions or ask for help. Last year, we had our first Bladder Cancer Canada Awareness Walk and raised $10,000. We're having this year our second annual Bladder Cancer Awareness Walk at Assiniboine Park in Winnipeg on September 23rd at 1 p.m. I'd love to see you all there. If you can't make it, we appreciate any donations people can give us. Any amount is not too little. In closing, I'd like to thank David Gutman and Greg Neely for coming from Toronto. They're from Bladder Cancer Canada. Thank you very much, Greg and David. I'd also like to thank Elizabeth Payne from Cancer Care for her presentation. I'd also like to thank Dr. Daryl Drakenberg, Dr. Joel Gingrich, Dr. Aldrich Ong, for all your help in helping patients. We can't thank you all enough for all you guys have done for the patients. You guys are doing such good work. Thank you very much. I applaud you all.